sir. But yeah,
Hypnotherapist, Ericksonian hypnotherapist.
psychotherapy, therapeutic hypnosis, and rehabilitation.
Yes, yes. He and his
Ernest
wife.
Lawrence Rossi. Yes, sir.
Yes, we invited him in 97 at Bangalore. We had a national conference in Nimhans at Bangalore in 1970, 1997. So 97, he and his wife both came.
Yes.
Ernest Rossi
I
and
I I found him, sir. Catherine Rossi and Ernest Rossi.
Catherine and Ernest, right?
Yes.
Both of them came.
He passed away in 2020. Is what I can say.
Aha,
Yeah.
aha, he passed away, I know. So yeah,
Nice. We will
Catherine.
read it.
Earlier also they visited Baroda long back in.
He has
Uh,
a lot of research papers, a lot of articles.
oh, he has written wonderful books also, and one of those books where he is describing psychophysiology. That book was reviewed by Dr. Jana, my teacher in hypnotherapy. He reviewed for international journal. He reviewed Dr. Rossi's book,
Got it, sir.
where he's describing psychophysiology. Psychophysiology. So there he
That
talks
book was
about
reviewed
aha.
by Dr. Chana, my
Yeah, aha moment. That aha moment is there. So he talks about that. Uh,
Got it, sir. We'll give it 5 minutes and then we'll get started.
okay, fine.
Yeah. With this, let
So,
people to join in.
right. Yeah, that's fine. Yeah, I'll be here in 2 minutes, huh?
Sure,
Right.
sir. Sure, sir.
Hello, everybody. Good morning, and thank you so much for joining in. We are going to wait for a few more minutes, and then we'll be starting by Hello, everybody. Thank you so much for joining in. We'll be starting in 2 minutes.
Good morning, Deepa. Yeah, your name is not written and it was difficult for me to identify you in the small window.
Oh,
Good.
okay. So, shall we start?
As per your wish, right? We can
Okay.
start.
Okay, sir. So we'll start. So, firstly, good morning, everybody, and thank you so much for joining. And a very, very warm welcome to everybody. And it's so wonderful to see your dedication to join this. And I'm very sure that you're going to have a lovely time here. I will also request everybody, if you're comfortable, please switch on your cameras. It would be lovely to see you.
Yeah.
Great.
मुझे भी सबके दर्शन करना है, तो दर्शन दे दीजिए एक बार.
Okay. And today we are honored to have such an esteemed expert with us, Dr. Palin. Thank you so much for being here and thank you for dedicating your time and your expertise with our community today. We are very excited to hear you. And before we jump into the session, I would like to introduce myself. I'm a Prajata and I'm a counseling psychologist at AHA Therapy. And I will also like to take this opportunity to introduce you about AHA Therapy. AHA Therapy is a platform made for psychologists to make their practice more smoother. And more than a platform, it is also a community built by clinicians for the clinicians because we understand and acknowledge the incredible life changing work you do. Our main goal or our main goal is to empower you, to equip you with all the resources and the backing that is going to help you to thrive in your career. And with this community connection, build we are trying to build a connection so that we are there for each other and together we can make a revolution to elevate our profession. So we are here to champion your growth. And now let's get started. And I would like to formally introduce Dr. Palan here. Thank you so much. And I would like to tell you something more about Dr. Palan. And it is my honor to introduce true pioneer and a celebrated authority of Dr. Bhupendra Palan. Dr. Palan is a highly accomplished physician and educator whose career span over decades of groundbreaking work. He dedicated 20 years of teaching physiology in government medical colleges and headed somatic medicine and hypnotherapy clinic at SSG Hospital, Vadodara. His pioneering spirit is evidenced by the fact that he is the first doctor in India to obtain prestigious diploma in clinical hypnosis from American Board of Medical Hypnosis in 1988. He then went to create and serve as the core faculty of postgraduate diploma in clinical hypnosis at MS University of Baroda. Dr. Palan is not only a medical expert but also a
There is some issue in Aprajita's network. I think we can get started, sir. I think we have enough people. She'll join in.
Perfect.
Yes, sir.
Thank you.
Yeah.
Connected.
So,
Uh, yeah. Rather, your voice is breaking, but I think Dr. Palan can get started.
thank you, Aparajita, and thank you all for inviting me on this wonderful in this wonderful community. Hmm. I was introduced to this platform very recently, and I'm quite impressed by the kind of idea and the dreams which they have. So, coming to the topic, I will be talking about hypnosis and hypnotherapy, which includes self hypnosis also. We'll be learning the history a little bit, and then we'll understand what hypnosis is not, because there are many misconceptions about hypnosis, even among professionals, psychologists, and psychiatrists, and other medical fraternity. So we'll understand what it is not, and then we'll understand what it is. And then we'll talk about the indications, uses of this wonderful science. But before I will go on the topic of hypnosis, I would like to spend initial about 10 minutes on something else, which I feel as therapists, most of us are therapists here, it is very, very important to be aware of some of the things about life in general. So here is my presentation, Hypnotherapy Introduction. I had an institute physically existing in Baroda till 2017 when I closed it down. And um, again in 22, we restarted the institute as online institute, and it is samatvam.co. The philosophy of our institute, Samatvam, is this: we are blessed with the tools. Let's cow ourselves. You know, we are blessed with three wonderful tools. I would call them divine means. One is the human body, miraculous. Huh? As you think about the body, the structure of various organs and systems and the functions and how the functions are carried out, it's really wonderful. So we have this miraculous human body. We possess it, we are blessed with it. Another important divine means which we possess is human mind. The scientists today say that we cannot measure what is the potential of human mind, unlimited potential. And we are blessed with the intellect, the kind of intellect which no other animal possess on this planet, and the amount of intellect. So the body, mind, and intellect, if we learn to utilize them for the right purpose in a right way, we can certainly cow ourselves. And at Samatvam, we guide people through various workshops, training programs, and individual counseling therapy also. I would like to dedicate this talk to my guru in hypnotherapy, Dr. Rishikesh Chana. He was the pioneer of medical use of hypnosis in our country, and I'll be talking about him a little when I talk about history. But before going on to the hypnosis, over a period of time in my life journey, I was exposed to human brain. I taught about brain physiology to undergraduate and postgraduate students in physiology for many years. And then I was exposed to the system of yoga. I took my yoga teacher's training course and learned Patanjali's Yoga Darshan. And it was very thrilling for me to learn it because I found a lot of neurophysiology in that yoga sutras and lot of many principles of psychology also. So that came in my life, and in connection with hypnosis, I learned, I would say, bit of psychology. I'm not a psychologist. I can't. You all must be knowing much more than me in psychology. But yes, in connection with hypnosis, whatever I came across, I learned it. So these three sciences, science of brain, science of psychology, science of mind, I would say, and the science of spirituality, gave me the understanding that this life, human life, which we are blessed with, which begins at our birth and ends at the death, this life is a pilgrimage for growth. विकास की यात्रा है ये. और विकास मतलब क्या? ग्रोथ. विकास मतलब ये आजकल देश में चल रहा है बहुत विकास, इंफ्रास्ट्रक्चर बनाने का, और ये आई एम नॉट talking about that vikas, the growth as an individual. And it is a journey of not one life, life after life. The scriptures say that from birth till end of life, what we want is happiness. Happiness, sukha, which is nitya, nirvela, and nirnimitta. I want permanent happiness. I want absolute happiness, no adulteration with any kind of unhappiness. And that can be there if it is nirnimitta. If my sukh is dependent upon something, some object, some person, some situation, then it's not going to last forever. And it will bring with it some amount of issues also, problems also, challenges also. So we are blessed with this human life for progressing in that direction. And life after life, as we progress, we all are ultimately destined to have that enlightenment where we have that. Now, in life, in human life, we have many relationships, and in every relation, there are a number of events happening day to day. There are situations and circumstances created. The scriptures say that in human life, we have 7 fields of relationship. And these 7 fields are universal, social, professional field, family field, physical, mental, and intellectual field. I am connected. I, to whom I call as I am connected with my family, with my parents, children, wife, and other relatives. I'm connected with my profession. I'm connected with universe, with the society, my social groups, my friends and my neighbors and my people in the government and all. I'm connected with my organization and the people there, and with family naturally. I'm connected with my body, I and my body, I and my mind, and I and my intellect. 7 fields of relationship. And in every field of relationship, we have desires, we have expectations from each other. My family, my children, my wife, my parents, they expect certain things from me, and I expect certain things from them. My profession, I expect good revenue and good prestige and all. So profession need me to be more sincere, more honest in my work. Similarly, social and even from the universe, I expect that there should be proper climate, and there should not be any tsunamis and earthquakes and all. Then the universe would expect me to look into the carbon emission and pollution and all those things. I expect my body to be healthy always, good looking and all. then my body expects me to look into my diet, rest, and exercise, which I give to my body. I want mind full of peace and calmness and serenity and happiness and compassion and confidence. And that kind of mind I can get by imparting some training to my mind. My mind wants me to impart that kind of training. And I want my intellect to be sharp, to be subtle. And for that, my intellect needs some kind of knowledge. So there are to and fro expectations. Sometimes our expectations are fulfilled in some fields, and many times they are not fulfilled. When our expectations are fulfilled, we find it to be a favorable situation. We find it to be our success, and we feel happy about it. But when expectations are not met with, we feel it is a difficulty, it's a challenge, it's a problem in my life. And we feel it is our failure sometime, or we blame some other people, or ultimately God, and we feel unhappy about it. So it goes on in every field of life, kabhi khushi, kabhi gum, ye chalta rehta hai. Now, Bhagwan Krishna is telling in Bhagavad Gita, is advising to Dhananjaya, and we are all Dhananjaya, perform action abandoning attachment, being steadfast in yoga and balanced in success and failure. So when I am exposed to the favorable or unfavorable situation, I'm required to perform some action. I'm supposed to take an action. But while taking action, I need to abandon attachment. Attachment with what? Attachment with my desires, with my expectations. Attachment with desire and expectations also cannot be abandoned completely, but attachment with my insistence, insistence for fulfillment of my desire. वो जो जीद होती है ना, that jeed is to be given up. So we need to detach from the jeed and with evenness of mind, with tranquility of mental composure while responding to any for opposites. If we start performing action, that is called yoga. This is one of the definitions of yoga in Bhagavad Gita. And this person is called Sthita Pragya. Earlier in my childhood, when I heard Sthita Pragya word, I thought the Sthita Pragya may be emotionless, blank, no anger, no fear, no confidence, no nothing in the mind, no happiness. But Sthita Pragya individual is not emotionless, neither the person is sentimental. भावना से हीन नहीं है और भावना से ग्रस्त भी नहीं है, वो भावनाशील है, sensitive. The person knows what are the feelings in my mind right now. He may feel all the kind of feelings, positive and negative. But before performing action, he would manage the emotion. And then he would perform action which is thoughtful, appropriate, and mature for that particular situation. So this is what exactly we all do in psychotherapies. All psychotherapies, we teach our clients to do that same thing. In any event, when you are having some feeling, if you appraise the situation by that feeling, that is emotional appraisal, we know, and that will lead to impulsive reaction. And what we tell our clients, what we try to we try to train our clients to go from here to here, giving mature and thoughtful action. And this need one very, very important, very, very crucial step. And that is noticing the thought process at the back of feeling. You are all more experts than me now in this area. Your CBT and various other kind of things, what you are doing. It is this, you are making the client to notice the thought process. As soon as you notice the thought process, something wonderful will happen. This situation will be then reappraised. And it is reappraised using the knowledge, values, education, and wisdom. That is what we call as cognitive reappraisal. So going from here to here, that would require us to notice the thought process and changing the thought process accordingly then, once we recognize it. And there comes the role of hypnosis, because the thoughts are created by the subconscious and they are just emerging. They are perceived in the conscious. So when we try to change our thoughts by conscious resolutions or understanding, knowledge, this is not enough. Understanding and resolutions need to percolate in the subconscious. Then the subconscious will create the new schema, new frames of references, and they will be utilized to change our cognition. So there comes the role of hypnosis. And even the neurophysiology today, with the advancement and availability of functional MRI and PET scan and all these tools, they are able to find out the correlates of these two things. Impulsive reaction by birth, there is a connection between the limbic system, which is the seat of feelings, there are emotion centers there, and the motor center. So this is the short circuit. One neuron and the next neuron leading to the motor action. And that is what we have been given by birth, and all the newborns and the toddlers, and they are impulsive in their action, emotional appraisal. But gradually, as the knowledge is created by listening and by seeing the people and reading and all, then these longer pathways start developing from emotion area to the thinking area and back to the knowledge area, and from there to the thinking area. And ultimately, it is given with consultation of the knowledge. The signals are given to the planning and decision area in the prefrontal cortex. We all know now all these things, dorsolateral prefrontal cortex and all those areas. And then the decision is made and it will be given to the motor center for carrying out behavior. This is a longer and more complex pathway involving large number of neurons and synapses. And for that, one need to train oneself. Of course, it also depends upon our upbringing from childhood till now. So there is this another pathway, and what we are trying to do in psychotherapy is that is what is known as neuroplasticity. This is the channel which is being utilized for many years by this client. Now we are suggesting the client to utilize this channel. And this channel can be trained by various hypnotherapeutic techniques or by various psychotherapeutic interventions. So I don't find any difference between what the psychologists are doing or what the scriptures have been telling for thousands of years and what the neuroscientists have now started searching for the correlates of these things. So that is what I wanted to begin with. And now let's go to, because it will expand the view of the client. When we give this, I give this input to all the clients, because the clients coming to us with agony, their mind is focused with their own single problem in one of the fields in their life. But when they come to know that there are 7 fields, and I have relationship with them, and there are events and situations taking place. So there is expansion of his view and expansion of gradually his ego boundary, and that brings about the preparation for bringing change. Anyway, so we go to hypnosis and self-hypnosis now. Now, usually people have idea about hypnosis from the stage shows where this kind of things are shown, that the person is agreed to be hypnotized, that the stage hypnotists have invited people who want to experience, they come, and some people go running there on the stage. So person is agreed to be hypnotized. Hypnotist has carried out some procedure, some mumbo jumbo, and demonstrated that Subject follows hypnotist suggestions. They call them commands. It's a very wrong word, suggestions. He seems unable to bend a straightened arm as he has been told that he cannot bend it. It is made up of iron and iron bar. You cannot bend it. He sniffs a bottle of ammonia with obvious expression of delight as he has been told the order was that of a rose. He remains relaxed and comfortable despite application of a noxious stimulus. Stimulus with damage is the pinprick or like that. Having been told that after awakening, he would nod if the hypnotist removes his glasses. Then the person awakes with no apparent recall for any of the events transpired, but he would nod without awareness each time the hypnotist removes glasses. So when all these things happen, we may agree that, okay, this person was hypnotized by the hypnotist. But these are all phenomena of hypnosis. They are phenomena of hypnosis, like motivation is one of the phenomena. Induction is also considered as phenomena or the procedure which we carry out. Ideomotor response is there, challenge reaction is there, hallucination is there, analgesia, amnesia. So these are various phenomena. By now, about 25 such phenomena are identified by the scientists that in hypnosis, person may have these, and may not have also. All the phenomena are not present. So depending upon that, we assess there are various scales like the hypnotic susceptibility scale or hypnotic ability scale, Harvard scale and Stanford scales, and we have various psychological testing tools. Anyway, so these are some phenomena. Even post-hypnotic suggestion is a phenomenon. Suggestion given during the trance will work after the trance is terminated post-hypnotically. The history of scientific use of hypnosis begins with Franz Mesmer. And Mesmer was a Viennese physician working in France, Paris, and he believed that disease are caused due to imbalance in magnetic fluid. They imagine some magnetic fluid to be there in the universe and in everybody's mind and body and everywhere. And he thought that he possessed some power by which he can balance the magnetic fluid of the patient. That was the theory. And then he gave name to his theory and practices, theory of animal magnetism and practice of animal magnetism. So hypnosis was known as animal magnetism then. But then the King of France appointed a commission called Franklin. Benjamin Franklin was the chief of that commission. Lavoisier and Guillotine were the other members. And they were assigned the task of investigating Mesmer's theory and practice because there was complaint by other medical people and other health professionals. So Franklin and his commission, they disregarded animal magnetism completely, and they gave a very strong remark that he should be banned to do it because he's not been able to demonstrate any such kind of magnetic fluid. And then the story ended there. Mesmer had to run away to USA without single penny in his pocket. But then came James Braid. He literally he read all his commission report and the correspondence with the commission used to have, and the people in the commission they used to write their notes and all. And he found that though the theory of animal magnetism was not right, but Mesmer used to get outcome. There was wonderful outcome, and he tried, and he could also find the outcome. So he gradually understood that it is a sleep-like state in which the client is able to have better control on the thoughts, feelings, behavior, and biology. So he called it hypnosis or hypnotism. Hypnos means sleep in Greek. So a sleep-like state. But later in his life, Braid understood that it was not a sleep-like state, because by then EEG was invented, and with EEG, when he studied, it was not sleep-like, where alpha delta activity is there. Here in this state, more alpha activity is there in the EEG. So he called it monoidism. Mind is getting focused on one idea, but that term was never picked up by most of the scientists, and still it is misnomer like hypnosis. And before Braid, before about 30 years of Braid, in 1830, a priest from Goa talked of hypnotic phenomenon. You might have seen this statue in Goa, Ave Feria. So Ave Feria told that it is not the power in the hypnotist, but it is the uh, ability in the person who is going into hypnosis. And that ability he named as apoptis, superior power of concentration, apoptis. And that was the beginning where then the more studies started. But then the research by James Braid was more popularized, and many scientists started working on that, including Freud, and many came in. They left it also later. So if we look at some important milestones, British Medical Council recognized hypnosis as a therapeutic tool in 1955, followed by American Medical Association in 1958. International Society of Clinical and Experimental Hypnosis was established in 58. American Society of Clinical Hypnosis also was established simultaneously in 58. And Indian Society of Clinical and Experimental Hypnosis was started by Dr. Chana in Ahmedabad in 1972. Okay, so since 72, even earlier to that, Dr. Jana started working. So he started working in 1960s actually, a pioneer of medical hypnosis in India. He worked as professor of physiology at Kasturba Medical College, Manipal, and then at Municipal Medical College, Ahmedabad. Incidentally, he was also a physiologist, and he was my external examiner in my MD physiology, but that time I was not knowing about this hypnosis part of it. I came to know it afterwards. So he was the founder of Indian Society for Clinical and Experimental Hypnosis in 72. He conducted large number of hypnosis training courses all over the country, basic and advanced courses. And I joined with him in 82. I went to learn about hypnotherapy for my own asthma. I had very severe problem of asthma, and read somewhere that maybe self-hypnosis might work, and that's how I entered in this science. He actively participated in every international conference. We have international conference every third year, starting from 1970 to 2003. He kept on attending, participating, and presenting his work in all these conferences, and he published many research articles. So he was the great pioneer of hypnosis in our country, and my guru. If we talk about recent developments in India, we started 1-year PG diploma course in clinical hypnosis in MS University in 2000. So 26th batch is going on now. But because MS University is a residential university, there was a lot of demand from various parts of the country to start online course. And this science is recognized by Ministry of Health and Family Welfare, Government of India in 2003. And based on the request from many people throughout the country, I started this online course. It's not online, it's a hybrid kind of course through Charotar University of Science and Technology, again, a very premier university. And I'll be talking about this course at the end. And in 22, we launched the Academy of Hypnosis India. It is a professional body of qualified clinical hypnotherapists. So these are the developments. And now let us see. Generally, people believe, and most of the people have misconceptions, faulty beliefs. People believe that there may be use of some magic, some mantra, some tratak in hypnotist, some supernatural power in the person who is hypnotizing the other people. There is nothing like that. Actually, one cannot hypnotize the other. That itself is wrong. One can guide somebody to go in hypnosis. Every hypnosis is a self-hypnosis. The therapist is guiding the person to go in the hypnosis, but the client himself is doing it. So there is no mantra, magic, tratak, or anything, any power in hypnotist. Only the people, and yes, some people have a belief that only people with weak willpower will get hypnotized. It's not true. Willpower and hypnosis, various researches are there, and it has found that there is no relation between the two. Even high willpower people will have low and high hypnotizable people, and similar proportion of high and low hypnotizable people are found in low willpower people. A person in hypnosis will lose control on himself. This is also faulty. Rather, the person will get better control. So, better control on one's own biological processes and psychological processes. And even if a strong suggestions are given, which are against the morals, ethics, moral values of the person, they are never followed. So, person is in control, person is not out of control. A person may reveal secrets during it. This is a very popular belief. But no, they don't reveal the secrets unless they wish to. There are therapeutic techniques where we do that subconscious exploration and all, but there the willingness of the person is needed to reveal certain things which may be relevant according to the person, client. And a person will not remember upon awakening what happened. So some clients, after undergoing the first session, they tell, doctor, I was not hypnotized at all. I tell, why do you say so? Because I know everything. Whatever you talked, I know. And there was some knocking on the door. I heard that also. So they feel that I should not be remembering. I should not be knowing what is happening. It's not so. Of course, this is one of the phenomena of hypnosis, amnesia. People who have amnesia, they may not remember anything. They may just say, okay, I just was sitting and you asked me to close my eyes and now you asked me to open my eyes. I don't know what happened in between. This happens in only 5% people. Complete amnesia in 5% people. In 30% people, there will be some partial amnesia, but rest 65% people would know everything. And this is something which is also a very common belief. A person may remain in hypnosis for indefinite period of time. Sometimes some of my clients have asked me earlier. Now, of course, people are with this social media and all those things, people are more aware. So somebody would tell me, doctor, suppose I am in hypnosis and then something happens to you. You may die. So what will happen to me? Who will bring me out? That was the concern. So I used to tell them, they used to say, ना करे नारायण आपको कुछ हो गया तो मेरा क्या होगा. तो मैं कहता था कि नारायण वो नहीं से करेगा, मतलब मेरी डेथ हो सकती है लेकिन आप जरूर बाहर आ जाओगे. हाँ, within 5-10 minutes the person will wake up, no matter how much deep trance the person is when the contact with the therapist is lost. So no problem. So there are some such beliefs. But then what hypnosis is? The definition you will of course find in the literature and all, but I would like to explain the definition. So hypnosis is a psychophysiological condition. It's a mind-body condition, psychophysiological condition characterized by enhanced focal awareness with reduced peripheral awareness. So we get into this state many times while watching interesting show on the TV or some movie. We get while listening to somebody who on the topic which we are interested in. We all get into that state. Our mind is focused on something, and the जो आजू बाजू की समानता है, peripheral awareness is reduced. When Guru Dronacharya is asking Arjuna that what do you see when he was asked to target at the bird's eye, he is telling, I am seeing only the eye of the bird. That is, he is in that self-hypnotic state. Nothing else is seen. We get into this state many a times during religious rituals, and many other situations are there. Then so that is enhanced focal awareness with reduced global or peripheral awareness. And there is reduced critical analytical stereotyped information processing, which is mainly the function of left hemisphere, we know, and enhanced uncritical, holistic, intuitive, or creative mode of information processing, which is mainly the job of right hemisphere. So right hemisphere dominance will be there. And therefore, metaphor and all that imaginary language will help more. And then there is altered perception, mood, and memory, sufficient enough to produce significant behavioral and biological changes. And there is decreased muscle tension and movement. The person is more relaxed. And there is intense and sensitive relatedness created with the operator. So this is the best way of developing rapport with the clients. Many of the medical professionals who do our postgraduate diploma course, it is available to medical professionals, those who have done MBBS and other degrees, or also it is available to psychologists. So our students are both medical and psychology students. Most of the medical people who learn, they never use it in their therapy because they are more busy and they are not interested in spending so much time. But many of them, when they meet me, they tell me, sir, we have found automatically our rapport with the patients has started increasing. It is like our way of communication with the client has changed. The vocabulary changes, communication changes. So all these things start happening. Even they don't start. So it is called occult hypnosis. They don't actually systematically utilize, but that happens because there is a sensitive relatedness with the therapist. If I explain you from neurophysiology point of view, this definition, see, there is reduced global awareness and increased focal awareness. How it happens? Actually, in the cerebral cortex, there is dissociated excitation inhibition. Some particular part of the cortex is highly excited with inhibition in the larger remaining part of the cortex. Now, how this happens? We know that there are two reticular formations. One is brainstem reticular formation, network of neuron in the brainstem. Another is thalamic reticular formation. Many of you might be aware, brainstem reticular formation has got widespread connection with the entire cortex, while thalamic reticular formation has got many different nuclei, and from one nucleus to a specific part of the cortex. So some nuclei of thalamus are connected with the visual cortex, some are connected with the auditory cortex, and like that, they have specific pathways. Now, in the induction process, there are some components. Various induction processes are there. And my observation, I have found that every client who would learn self-hypnosis would make one's own technique. So there are a number of techniques of induction of hypnosis. One of the component in many techniques is hyperventilation. They are asked to breathe in and out fast and deep, that Vastrika type of thing, which is utilized by that Sri Ravi Shankarji, in that method. So when there is hyperventilation, carbon dioxide is washed out from the body, and that will create decrease in the partial pressure of carbon dioxide in blood. And this decreased PCO2 level will increase the excitability of brainstem reticular formation. So these neurons are, it will give rise to decrease in the excitability of brainstem reticular formation. So this is one. Second, I'm sorry, this arrow is wrong. It will decrease in the carbon dioxide, will activate the brainstem reticular formation, where there is a respiratory center also, and therefore after hyperventilation, there will be more carbon dioxide washed out, so there will be need for more oxygen, more removal of carbon dioxide. Anyway, we'll not go into that physiology at the moment. The relaxation of the body. I'm sorry, I got lost in explaining this thing, but this is correct. When we hyperventilate, more carbon dioxide is eliminated from the body. The breathing, main job of breathing is not providing oxygen to the body. Main job of breathing is to eliminate carbon dioxide from the body. So when the carbon dioxide level is low, the breathing become shallow and slow, because there is no much carbon dioxide in body for elimination. But that slowness of the breathing is brought about by decrease in the excitability of brainstem reticular formation. Carbon dioxide acts as a stimulant for brainstem reticular formation. That is what I wanted to tell you. I'm sorry for that. Now, another component in hypnosis induction is relaxation. In most of the techniques, person is asked to do physical body relaxation, muscular relaxation. So muscular relaxation will decrease excitation of brainstem reticular formation, because the proprioceptive signals, which go from the muscles and the joints to the brain, proprioceptive or kinesthetic signals are reduced, and so that brainstem reticular formation is not given those signals, and its excitation will be reduced. The third component in many techniques is immobilization. The person is asked not to move the body much, unless there is a need for becoming more comfortable. Remains still or don't move the body much. When it is told, what happens? This immobilization of the body, and also in some techniques, the eyes are immobilized. They are asked to look at a particular spot on the wall or on the ceiling, or they put that pendulum or anything. So body, when it is immobilized, again the proprioceptive signals from the muscles and the joints are reduced, so reticular formation of brainstem is suppressed, and immobilization of the eyes also will reduce exploratory signals. Eyes are exploratory sense, eyes and ears both. So that exploration by of the environment by the eyes is reduced, and that will also reduce the excitation of brainstem reticular formation. So there are 4 mechanisms leading to reduced brainstem reticular activating system neurons. On the other side, when the eyes are focused on some object, there is constancy of visual field, constant visual field. And this constant visual field will lead to monotony. Some monotonous signals are going in the brain. Not only that, but the hypnotist is talking something, or the person who is guiding, person is talking something, and the speech delivery is with constant amplitude and rhythm. When helping person in going into trance, my speech is make yourself comfortable and keep your eyes gently closed. Attend to the process of your breathing. So there is a different kind of tone, slow tone and rhythmic. This will add into the monotony, and both together will create activation of some particular nuclei in thalamic reticular formation. So this thalamic reticular formation specific nuclei activated, they will give rise to concentrated focus of attention. Some part of the cortex is activated. And when some part of the cortex is activated, there is one more phenomenon called negative induction. the surrounding part of the cortex will create inhibitory signals going to the brainstem reticular formation. There are Rinso shell, that's called Rinso shell mechanism. So when cortical, some part is activated, the surrounding region will create negative signals, inhibitory signals going to the brainstem reticular formation. This is fifth mechanism which will reduce the activity of this generalized system. So when generalized system is inhibited, there is entire cortex is inhibited, and that will give rise to global awareness reduction. And some particular part of the cortex is activated, which will lead to concentrated focus of attention. This is how the induction can be understood. And most of the guided meditation also do the same thing. Guided meditation, I don't find any difference between hypnosis and meditation. Their purposes may be different, but the physiology is same. Even the neurophysiology and even the biochemical changes are same in meditation and in hypnosis. Okay, this is another theory proposed long back, but this is a good theory which will explain certain things about hypnosis. Hypnosis, when the client is going from waking to the hypnosis state, what happens? The hippocampus part of the limbic system is activated with concomitant amygdaloid inhibition. But when the person comes out of the trance, again, amygdala is activated. Hippocampus activity is reduced. Hippocampus is concerned with long-term memory and mature kind of thinking, what we call as wisdom, and all these functions nowadays, scientists are able to correlate the hippocampal activity with this. So when the person is taking decision under hypnosis, those decisions are more useful, more valid for the group of people or for the industry, and they did some research with corporates. So when the higher authorities want to make some decision, crucial decision for the company, they are taught to do hypnosis and go into the trance, and then in hypnotic trance, when they make the decision, they turn out to be much better compared to the decisions made in the waking by the same officer, by the same people. So many such research have shown that this theory is quite that way valid till now. But there are a lot of things happening now. There is, in more recent years, psychophysiological model is proposed by Crawford and Gruselian. So they see that during the whole process of hypnosis, the person is passing through early induction, later part of induction, and established hypnotic state. And in all these three, there are some EEG changes. There is a EEG study. So when the client is going into the trance, when the process is begun, there is increase in the left frontal limbic region activity. And this is the part of the brain which is concerned with logical thinking and all we know. So this is happening in early induction. The client is listening, not only hearing, but understanding what instructions are being given and following those instructions. But slowly, the person will enter in later part of induction into another phase where there is left frontal limbic region activity is reduced. So there is letting go of controlled attention. So when the person would come out of the trance and you ask, the person may say, I was hearing your voice, but I was not able to understand what you are talking. The understanding was not there. I was just hearing some sound, somebody is talking something, that kind of thing, because of this reduction in left frontal limbic region activity. And in the established hypnotic state, right temporo-occipital system, that is activated, and that is important for engaging in passive visual imagery. So this is there. And then number of studies have, there is a flooding of neurophysiological studies in hypnosis after 2000. And now with this AI into the picture, it has gone beyond the scope of my understanding. But anyway, there are a number of other theories, but we will not go into that, more recent theories, because they are more complex and we need to understand brain physiology for that. So I will avoid talking on that. And then what is hypnotherapy? Say induction of hypnosis and termination of hypnosis is just a, a mechanical thing, like giving injection. Huh? One can learn how to give injection, and that do not require you to go through medical course. Even these compounders give injection, and sometimes ward boys also give injection. But then what medicine is to be filled in that injection, how much dose, and what are the actions, and what are the side effects of that medicine, and all those things, that is the doctor's job. So in that way, somebody is very expert in inducing hypnosis, eliciting various phenomena, and then terminating. That is the stage hypnosis. They are more efficient in doing that job. But they don't know that therapy part is any psychotherapy. When you utilize, when the client is in hypnosis, that becomes hypnotherapy. So hypnotherapy is not a different type of therapy. You may use CBT, you may use any other therapy in hypnosis. That आजकल hypno CBT तो बहुत popular हो रहा है. So hypnotherapy is essentially communication of ideas and understanding to a patient in such a fashion that he will be most receptive to the presented ideas and thereby motivated to explore his own body potentials for the control of his psychological and physiological responses and behavior. Milton Erickson's statement. And finally, let's go to the indications where the hypnosis is utilized. There are number of applications of hypnosis. One, for normal healthy individual, for healthy living and realizing the potential, which will include stress management and developing resilience, lifestyle management, enhancing motivation, confidence building, decision making, developing assertiveness, improving concentration, memory learning. A lot of positive outcome in students. We conduct one program for these adolescent children, 10th, 11th, 12th standard students. It is also there on my website, available, that program. So it is very useful to them. Developing muscle skills in sports even. One of the known sports person is Cheteshwar Pujara. He took self-hypnosis training from me and did very well in cricket. And there are various other sports people also who have reached to some level in their career. But it is very useful, for I believe that everyone in the society should learn self-hypnosis and practice it. मैं मेरे सारे स्टूडेंट्स को कहता हूं कि आप खुद करो, whether you do it on your clients or not, and many of them, almost 70% of them are practicing self-hypnosis. Many of them are sitting here in front of me. I am not able to see them, unfortunately, but I know that. Anyway, so that is there. Now, apart from for healthy people, it is useful in managing psychosomatic disorders. And there are a number of them, and now you know, according to DSM-3, so this term itself is eradicated. There is 5-axial classification and all that you know much better than me. But then these are classical psychosomatic disorders like migraine, asthma, peptic ulcer, ulcerative colitis, IBP, arthritis, coronary heart disease, IBS. Number of studies are there on IBS. It gives wonderful outcome, and menstrual problem and many others, skin problems and all. This nomenclature is based on earlier kind of classification, because I belong to that era. Anyway, Then comes the habit disorders. I have some work which was later on published in a book also as a chapter, stammering. It's a very good area where we get good outcome, disfluency in the speech. And in bedwetting in children, there also we have very good outcome in younger children, 6 to 10 years age, 6 to 12 years age children. Thumb sucking, nail biting. Of course, in adult also it works very well. Thumb sucking, nail biting, tics, obesity, all these areas, it has good outcome. And then comes the pain management. There are a number of researches and evidences for pain management nowadays. Hypnosis and pain management is a very hot area nowadays for research. Labor pain, musculoskeletal pain, and dental pain, pain in of injuries. So sports people are used. They are helped by these. They recover much faster. Pain of burns or pain of terminal cancer. There also it has helped, but not to all people. It required the phenomenon of analgesia, and that is present in almost 60-70% people, so they can be helped. And anesthesia is possible only in some 20% people. They have complete anesthesia also can be carried out under hypnosis. But nowadays, the science of anesthesia is grown up and we have very good chemicals by which measured amount of anesthesia depth and duration is created. So hypnoanesthesia is out of context now, but then it was shown earlier in between 1945 and 50, one Dr. James Estale in Hubli, Calcutta, near Calcutta, he reported more than 150 major surgeries under hypnoanesthesia. But nowadays it is out of context anyway. And if we consider the other psychiatric conditions like in anxiety, in phobia, anxiety also number of studies you will find in the literature for hypnosis is very useful. Dealing with phobias, dealing with OCD patients. Many times they require medicine also, of course, and mild to moderate depression, sleep disorders, and in this what we used to call as psychotic conditions like schizophrenia or bipolar. But here medicine is required, and always I suggest the psychologist to work in liaison with psychiatrist. I also started working with Dr. Khurana like that. He was our professor of psychiatry. And initially, he never allowed me to touch any psychotic patients, but gradually he started allowing me, and we did. Dr. Jana has a lot of work in schizophrenia and hypnosis. One of his papers I read because he couldn't come in only that conference, the Netherlands conference, where I had been. So I read his paper in hypnosis and schizophrenia. Okay. So with that, I'm reaching towards the end. And at the end, I would like to describe one of my cases. This was a very typical case, well documented, and it got published in American Journal of Clinical Hypnosis. So it was a good case, which I would like to share with you. So there was a 24-year student. He was doing his BSc first year. 24 years in BSc first year because he failed in the 12th exam maybe 4 or 5 times. He had repeated episodes of hemoptysis for 4.5 years. Hemoptysis means blood coming out in the sputum. There is khasi, coughing, and the sputum comes out with blood. You know, in our country, most common condition is tuberculosis of lungs and malignancy of lungs. These two conditions, the hemoptysis take place. Of course, it's a very old case. He was brought to me in 87 when I was a beginner in I started doing hypnotherapy from 82, 83. So he was brought to me in 87. So His symptom episodes were related with academic exam periods, um, which were perceived by him, exams were perceived by him as threat. And there used to be more symptoms. As soon as he will decide to take the drop or the exams are over, he is absolutely normal. And then again, next exam, he will start having the symptom. This used to happen cyclically. This kind of cyclical biological issues are also like goes more in favor of psychosomatic. Particular time of the day, they have vomiting and this kind of thing. Clinical examination and investigations were not indicating any organic cause except presence of blood in the sputum. Twice he was admitted in Jeslock Hospital, Bombay. You know, Jeslock was the first corporate multi-speciality hospital in the country. In 87, he was admitted there also before that. Many chest physicians also worked with him, but nothing was positive except blood in the sputum. No response to empirical anti-cox, tuberculosis medicines, tuberculosis, anti-tuberculosis medicine were given by two chest physicians, but there was no response, and then it was terminated. And when he met me, he was completely frustrated. He never wanted to see anybody. His mama, his maternal uncle, brought to me. He was a doctor, his maternal uncle. He was a pathologist, so he brought to me with force. He had depression and many times irritability and anger bouts. But of course, after one or two sessions, he was interested and he like developed a lot of good faith and rapport with me, with the science. By nature, he was perfectionist and he always wanted to be first rank. And he was. Up to 10th standard, he was first rank. And up to 11th standard, 12th only, that board exam, he started having problem. Anyway, so this was some history points. And the hypnotherapeutic ego strengthening and age regression helped him age progression I did with mental rehearsal for upcoming social gathering in the home. So that technique helped him. His sister was to get engaged. The engagement ceremony was there, and he was quite anxious that people will come and everybody will advise my parents कि उसको homeopathy दे दो, उसको naturopathy ये करा लो, मैं थक गया हूँ अभी. So he was quite anxious about that event, but this session helped him in overcoming anxiety, and he was comfortable meeting people during that social gathering. So then when he came, his that first year BSc, some internal exam was coming. So for that upcoming examination, when I used the same approach, age progression and mental rehearsal, it did not work. Rather, he started having coughing during the trance itself. So I terminated it. I terminated age progression and did some other therapeutic work to make him comfortable. And what I advised was to drop out from this particular exam, upcoming exam, and rethink about his career. I counseled his parents also not to interfere with his decisions. And this boy then came out that in later session that I would not like to do BSc because he considered it to be mere BSc. He had a group of 7 friends and all of them were in professional branches. Some were doing medicine, some were doing engineering and all, while he was the only doing this simple graduation. So he told that I'll be changing my branch and in future as a career, I would like to be a good teacher. This was something very significant. He decided to become a teacher. And then in one of the sessions when I was doing exploratory hypnotic dream induction technique for exploration of his subconscious, with age regression. So he remembered he came out with some emotional traumatic event, and he started describing it to me while being in trance. That he was reliving that in the trance. And what was that event? Now, this boy, as I told you, was very clever in his academics up to the board examination of 10th. But from 11th, he started having some issues because his father was transferred to some other province from Gujarat. He was transferred to Assam, and there he started repeating his 10th standard board exam. Actually, during 10th standard board exam, he was sick with jaundice, and then he was advised to not to take the exam. He was advised total bed rest. So, though he was the most clever student in the school, he was not able to appear for the 10th standard exam. Then they shifted to Assam, and he was studying in that Assami school where all the children belong to that state, teacher also, and he was the only Gujarati student. And the teacher asked him that why you couldn't take the exam last time? Why are you repeating? Then this boy is telling, Madam, I was sick and I was on bed rest. I couldn't appear for the exam. And that teacher is commenting. What was the comment of the teacher? Which was perceived as which was emotionally appraised. This answer was emotionally appraised, and he felt very deep hurt and humiliation. The teacher's comment was, yes, yes, I know. Gujarati students are very weak in their body and mind. They are poor in their studies and fall sick during exams. To drop out from the exam, they can't progress academically. So this was a general comment regarding these students from this part of the country by the teacher, and that created deep hurt and humiliation. Not only that, at that time, the boy was suffering from sore throat and coughing. So that suffering of sore throat and the hurt and humiliation with the remark of falling sick during exam, all these things together created a schema. And this is how the it's not psychological schema, it is psychobiological schema. That is what we can call it program or frame of reference. So it was created like this. That I recognized later because in that session, the suggestion which I gave was you being a clever student will take this up as a healthy challenge rather than doubting your own efficacy. These were my words. That time I was not knowing what is cognitive reappraisal, but it just came out naturally in 87. I don't know whether this term was there or not. But anyway, and this worked very well. When he came out, he was very comfortable. And then he decided to go for the study of ICWA, that accounts, and he did that. There are two exams, first year and second year, and very few, hardly 2, 3, 4% students used to pass that exam at first attempt. So he passed both the exams at first attempt, and then he started his classes for training CA and ICWA students, and he became the most popular teacher in the city of Baroda for CA and ICWA. So he really converted his threat into a challenge. And then Dr. Lakhani is one of my friends, a chest physician. He joined with me in treating this boy medically, and then it was published in American Journal. So this was a well documented case, and there are a number of such cases which I had opportunity to work with. So it's a very powerful tool. Now, coming toward the end of the talk, we have this postgraduate diploma in clinical hypnosis, which is a hybrid kind of course by Charotar University of Science and Technology and Samatvam. We together do that. It's a 1 year course where the theory lectures are received online, video lectures, and students come 3 times to Baroda. Baroda is the university belongs to close by Baroda, but we have these training programs in Baroda. So that is on campus. We give demonstration, practical, and hand-on practice. They come 3 times during the year, and each time they come for 5 days. So total 15 days intense practical training from morning till night, and theory they have done on online. So this kind of course is there. That's become very popular. People who are interested may visit this website. You'll be receiving this presentation. So, or you can inquire with Dr. Baljeet Kaur, who is coordinator of this course, or you can write to me also. So with that, finally, I pray for all of us that let our journey towards the ultimate goal continue. Not only our journey, because we are so fortunate to be in this field, we are able to guide and help many, many people who need it. So let our journey and their journey who come to us towards the ultimate goal continue. The ultimate goal is that permanent, absolute, and independent happiness. नित्य निर्भेल निर्निमित सुख. वो जर्नी में हम